Hello and welcome to the show. I'm Matthew Oliver Kondua, and I'll be filling in for Louise, who's on leave. And one thing that we want to talk about or touch on today is the 29th of October. Now, that day is commemorated as World Stroke Day. And here with me in studio to talk about more, I have the team from CWM. I have the emergency doctor at the CWM, Manisha Tuima, and also stroke nurse at the CWM, Amy Shankaran. How are you? And thank you for coming on the show.
Thank you, Matthew.
Thank you for having us.
One thing, I've always known about stroke. I had a family member who had suffered from stroke, but I never really understood the whole, basically, what happens to someone when they have stroke. Would you mind explaining more on that?
Okay. So stroke is basically when part of your brain gets damaged. That's what we call stroke. How the brain gets damaged, there's two ways that can happen. Is when blood supply to the brain gets disrupted. We need blood supply to all parts of our body so the parts of the body can function properly. But when this blood supply is disrupted, our cells start dying. And just like that in our brain, when the blood supply stops, our cells start dying. And that's when patients have a stroke. So one way that can happen is when our arteries, these are the blood vessels, the pipings that supply blood to different parts of the brain, it gets clogged. So how it can get clogged? It get clogged. Clots form in the blood vessel itself. So that's one type of stroke that we have. We call it a ischemic stroke when there's not enough blood supply going in. Ischemic stroke, sir. So the second type of stroke we have is called a hemorrhagic stroke. That's when the blood supply in the brain, it can break open and bleeding can happen in the brain. So blood will seep through that blood vessel because the walls are damaged. The blood will seep into the tissues of the brain, and that's when they have a stroke as well. So these are basically the two types of stroke we can have: ischemic stroke and a hemorrhagic stroke.
Which is the most common one in Fiji?
Both are actually common. So ischemic stroke is just as common as hemorrhagic stroke. So when a patient comes to the hospital with a stroke or signs of a stroke, we won't know which type of stroke they're having. We do start thinking about stroke early on, depending on the history that they bring in with, the complaints that they come in with, the type of examination findings that we get from the patient. But we won't know the exact type of stroke they have until we do a CT scan. That's when the patients go for a CT scan, and then we realize whether it's a ischemic stroke or a hemorrhagic stroke, sir.
And stroke is usually common between what ages?
Stroke is mostly common in our elderly population. It's still mostly common in our elderly population, but we have started seeing younger patients come in with stroke, as with heart attacks. The youngest patient we have in Fiji is a 12-year-old.
I read that online, and it was quite shocking to learn that. I mean, how come? I mean, how does a 12-year-old suffer from stroke? How did that happen?
So stroke has some risk factors that make you more likely to get a stroke. For the younger patients, it's mostly when they have a pre-existing medical condition. Most of them have a heart condition. So it can be a valvular heart disease, or it can be infective endocarditis. So both of these heart diseases make them more likely to get a stroke, meaning their valves are not working properly in the heart. So blood can pool in the heart and clots can form there. So when clots form in the heart, one of those clots can travel in your body and it can end up in your brain, and it can cause a stroke over there. That's when the artery gets clotted.
So is this prevalent more in men, or is it in women as well?
We see stroke in both sides of the population. So male and female both come in with stroke.
So both the genders.
But in your experience, who is more likely to suffer from a stroke, a male or a female in Fiji?
I think our...
You've had more cases of males or female? Which out of the two? Or has it been like
There's
quite...
not much of a difference.
Yes.
There's not much of a difference whether it's a male or female. It just generally comes down to the risk factors.
And
The
does
risk factors are the ones that determine.
Yes.
would ethnicity also be something that you see more of a certain type of ethnicity suffering from stroke?
Not really. Again,
No.
we see equal amount. Whether the patient is Itoke patient or Indian patient coming in, Chinese patient coming in, all get stroke. So it crosses the racial lines, crosses the gender lines. Any patient from any group can have a stroke. Depending, like staff nurse Amy said, depends on the risk factors that
Risk
are
factors, eh?
in
And
present.
what are some of these risk factors?
So if you have diabetes, hypertension, smoking, alcohol, all those. And if they're left untreated, especially with diabetes and hypertension, and like Dr. Manisha mentioned, for the younger generations, untreated cardiac conditions as well.
And
The heart, heart
Yeah.
problems.
so obviously, you also said that you've seen a number of cases in young people when it comes to heart attacks. Why is that?
Smoking. I would say it's smoking because there's a lot of younger people who are smoking, not having good physical activity. The nutrition is bad. That's why Fiji has one of the highest rates of diabetes right now. So our NCD rates are skyrocketing because of our lifestyle choices. But unfortunately, the young ones that we see, the 12-year-old boy with stroke and the other young people with stroke that we see, it's because of valvular heart disease. This is not in their control. This is not something that they brought on themselves. This is from pre-existing conditions, so the valves in the heart are not working, or they have rheumatic heart disease, which predisposes them to get a stroke. But the other population that we're seeing where their health is not being well looked after, they're smoking, drinking a lot of alcohol, not exercising regularly, not eating the right types of food, that makes them more likely to get a stroke.
And for our younger viewers who probably are watching this right now or listening in, what would you say to them in cases where they would probably be experiencing some form of a heart condition? Like, what are some of the signs they can look out for?
Okay, so for the heart conditions, if you're having chest pain, basically, we would advise you to come to the hospital. You will never know if you're having a heart attack until you come to the hospital and you get seen properly by a doctor. So that's what we advise. If you have chest pain, if you have some breathing difficulties, come straight to the hospital. And this is one time where we need them to come to the hospital fast. And in the same manner for stroke patients. So some of the things that you look out for is, if there's some facial changes, so family members would notice it before the patient would notice it.
Yeah.
If they see some changes on the face, if one side of the face looks different from the other side of the face.
So almost like it's dropping.
Yes, so there's drooping of the face on one side, there's facial asymmetry. The other thing they can look out for is some slurring of speech. They're not talking properly, either the speech is being slurred or they can completely stop talking all of a sudden. Something else that they can notice is their family members talking to them, but they don't understand what the family member is saying.
Thank you, Dr. Tuima. We'll just come back right after the break, and we'll learn out more about how you can identify a family member or friend who's experiencing a stroke. You're watching Speak Your Mind. Welcome back. You are listening, or rather, you are listening to Speak Your Mind. You with we have the team from CWM, the stroke team, and like I was talking to Dr. Tuima, you're basically explaining some of the symptoms that people should look out for: the droopy face, the slurred speech, not being able to understand their family members when they're talking to one another. What's other signs that family members or people should look out for?
So one other main sign that they should look out for is weakness, either on one side or both sides. All of a sudden, the patient is not able to mobilize like they used to, or they start limping somewhere. So that's another big sign that it could be a stroke. And some of the subtle signs that they can look out for is an unstable gait, or the patient starts feeling dizzy. They start complaining of dizziness, like the room is spinning. So that's one other subtle sign of a stroke that they can present with. So we would prefer that they come to the hospital fast.
Immediately.
Yes, please.
So one of the things that we spoke about is lifestyle, and across the board with every NCD that we're facing in Fiji, it's a very pressing issue. Now, as a stroke nurse in the CWM hospital, what's some of the things that you face, Amy, in terms of family members trying to bring in certain foods for a family member who has gone through a stroke? Is this something that you go through on a daily basis?
Yes, Matthew, thank you. We normally notice it, especially on the first few days when they come in to us.
Yeah.
So, because with the patient that comes in with stroke, they don't this normally it's the first time that they come in, and some of them don't know that they have diabetes, or they have high blood pressure, and then they come to the hospital and the sugars are high and the pressures are high, and then that's where our doctors, they do the investigations, and then they find out, okay, you've got diabetes and you've got high blood pressure. But remember, these patients that we have, they have this they've come in and they've got this lifestyle from quite a while back. They follow a certain way of eating and drinking, and then to come to hospital for them and for us to say, you're not supposed to be eating this, you're not supposed to be drinking that, it's sort of hard for them. So that's where we ask the dietitians. The dietitians, they come in. As soon as they come in, then we get the dietitians' help to come and we talk to the patients. But if we have very sick patients, we also get them to talk to the relatives. We talk to the relatives, and there's a list that we give them. And then we also monitor the food that they bring in. Sometimes I might not sound nice, but we stop them from getting food from home, at least for the first 3 days or first 4 days that they stay in hospital, so that they get used to the food that we're eating. And then once they're seen by our dietitian, then we allow them to get food from home, but
following the guidelines.
Yes, following the guidelines that the dietitian has in. So we look at it, and then we're like, because eventually that patient will have to go home.
And requirements with the diet, what are some of the guidelines? Is there like less sugar or low salt?
So low salt, low fat, like no low cholesterol, fatty foods, oil. It's quite a lot of things. Most people have to make a lot of changes, so we tell them to make the changes gradually, because this is like a whole new thing that they have to get used to. So that's why we ask them that while they're in hospital, they see the dietitian, and then they get food. They can get food after seeing the dietitian, then they can get the food from home. Then we see it, and then we tell them, okay, these are the ones that you're supposed to eat. Then when they go home, that they used to that, the food that they get.
Now, I know for some of the family members that come, clearly, for a family member to go through an experience like that, it can be quite tough on the rest of the family. So does your team offer any form of counseling for both the family member or the person who had suffered the stroke?
Yes, we do. After the team sees them, we also have our counselors at Empower Pacific. So basically, somebody with a stroke, we don't look at only the physical aspects of things. There's also, because it deals with the brain, and since the brain is the main computer system of the body, you also are emotionally affected, and also the family, because it's a big change for them too, especially if you were a fully mobile person just a few days ago, and then you come in and then you're totally weak on one side, and you're not able to move, eat, talk, and then you're dependent on somebody, and it may get depressing at times. So yes, we do the Empower Pacific and at CWM, and we also have the social worker available, and we do refer them for them to be seen by our counselors.
And in your experience, in like, let's say, a month, how many patients come in who have suffered from a stroke?
Usually, most patients come through our emergency department, not just at CWM Hospital, but through Wallevu Health Center, Nusori Health Center, and then our different hospitals and health centers all over the country. So usually in ED, what we see is at least 1 stroke or 2 stroke patients will come in a day. So there's a big burden of disease from stroke and from heart attack or cardiovascular diseases in Fiji. So there's a lot of patients who do suffer from stroke in Fiji. But like Staff Nurse Emmy was saying, just to add on to that, our team from CWM Hospital have been going around to the different health centers in the Suva subdivision to train the caregivers. So these are basically the family members who are looking after the stroke patient. So it's not the end when a patient gets diagnosed with stroke. There's so much more after that. So our care has become so much better that the patients are getting, we are aiming for a better quality of life for the patients. It's not like a death sentence. So our over the past few months, our team from CWM Hospital, made up of the stroke nurse, the doctors, the nurse practitioner, and the physiotherapists with the dietitians, they've been going around to the different health centers to train these caregivers, the family members who are looking after the stroke patients at home.
And okay, so your team also, or you just said, goes to the health centers. Do they also do create awareness around the community where the health centers are?
Yes, we do. So that's where we get the zone nurses in, and just like Dr. Manisha said, when before we go out to those health centers, we tell them that we are coming, and most of the people we have trained, village health workers and patients or relatives that have had a stroke.
Mm.
So we go out and then we get them, and we've been asked a few times to come back again, come back and train them again, and some people have been thankful that we've come, because mostly they, when somebody goes home with a stroke, they think, like Dr. Manisha said, it's not the end. There's
Yeah.
help for you there, and that's why we're here.
We'll be back after the break, and if you're listening in, remember, there is always hope. Welcome back to the show. You're on Speak Your Mind with Matthew, and with me in studio, I have, of course, there's emergency doctor at CWM, stroke emergency doctor at CWM, Manisha Tuma, and of course, stroke nurse at the CWM, Amy Shankaran. Welcome back. Now, we were talking about, some of the, basically, with family members and what they go through, but there's obviously some misconception around stroke. What are some of the common misconceptions that people have?
I think the main thing I would want to talk about is sometimes when you have a patient at home who has stopped responding, all of a sudden, whether it be due to stroke or some other reason, families have a habit in Fiji. I see they'll run for either water mixed with sugar or something they'll want to put into their mouth to revive them, because I think a misconception we have is most patients who collapse or stop responding, it's because there's not enough sugar in the body. So if we have a patient with stroke, a lot of functions get disrupted when the brain gets damaged, and sometimes they are not able to swallow. So when these patients, if you're giving them water and they're not able to swallow, the water can end up in the lungs. That's in the wrong place, and that's where we don't want the water, because they can stop breathing, and this we have seen. So what it causes is infection in the lungs, and it can lead to death in this stroke patient, something that can be easily prevented. So yeah, one message I want to pass to our public is, if you have a patient who is displaying all these signs of stroke, or who has suddenly stopped responding, just bring them over to the hospital, get them checked properly.
So just right there, why mix the sugar with the water? I'm trying to understand that bit.
So just like Dr. Manisha said, mostly when someone collapses, they would think that it's probably due to low sugar.
Okay.
So that's some of the
and usually
signs.
the person in this particular case would be someone going through or suffering from diabetes.
Yeah, could be. So that's what they would do: mix sugar with water and then just give it. And normally to an unresponsive patient. So like what Dr. Manisha said, one of the functions that can be affected when you have a stroke is your swallowing.
Yeah.
So if most likely if that person has had a stroke and it's unresponsive, and you try and put something in the mouth,
Big no-no.
it's just going to go to the wrong place, and then that's going to cause more harm.
And does diabetes and hypertension go hand in hand, or usually most cases they are quite separate?
So it's two different medical conditions, but a lot of times we see it go hand in hand, because it's the same group of people who would end up getting hypertension or diabetes. It's
When you mean same group of people who have the exact same lifestyle?
Yes, that's exactly what I mean. So basically, we're not exercising enough. If I stop exercising, if I'm taking a lot of salty food, sweet food, and fatty foods, or I drink a lot of alcohols, binge drinking, and then smoke every day, so I would end up getting both the diseases, diabetes and hypertension. So it's same group of people who can end up getting the same disease, but it's not two different medical conditions. Yeah.
I read an article somewhere a couple of years back stating that Yangona was almost like the lead cause of stroke in the country.
Up till now, there's no evidence
No
to
evidence
suggest
to
that.
do
Yes. I don't have any evidence to
sorry
support
about
that.
Okay, so now that's out of the way. One of the things that I've always wondered about was, because it affects the brain, Is there any brain damage or permanent brain damage in that particular case?
So because the blood supply to that area is disrupted, or because there is blood pooling in the area where the brain cells are supposed to be, there is damage to the cells, yes. And our brain cells are such that when it's damaged, it does not get repaired. So that's why we prefer that the patients come to the hospital as quickly as possible, because stroke care has evolved, so we can provide a lot of things in the emergency department or at the health center. So if the the blood pressure for the patient is very high,
Yeah.
we can try and bring down the blood pressure a little if we're thinking of hemorrhagic stroke, for instance. So if we bring down the blood pressure, then the risk of other cells being damaged goes low, so other cells don't get damaged.
Well, obviously, there's a lot of medication that goes with someone who has experienced stroke, am I right? Afterwards. Has there ever been instances where you've looked at a more holistic approach, or do you tend not to let patients know to take the recommended medication that you are prescribing to them?
So the medications that the doctors, these are the internal medicine specialists, the neuro specialists in the hospital attend to these patients. The medications they prescribe has had evidence. There's evidence to support that those medications work. And I would advise the public to strongly listen to this advice that's given in the hospital.
Because I can understand a lot of times, you have people who say, okay, don't take the medication, you take this medicine that I will make you. And has that been a problem for you as a nurse?
Yes, there has been. We've had people. So, because when you have a stroke, if it's if one of the vessels in the brain, if it's a very small vessel that's damaged, after about 3 to 6 months or a year, they might start to feel better. And so you go home and you do your diet, you change your lifestyle, you take your medications, you come for clean for 1 whole year, and then you will feel better, and then you stop taking your medication. So that's what we tell them. The risk of you having a stroke after you had the first one is it actually increases because now that you're on the medication than before you were on the medication. So that's why I tell you it's very important that you stick with that, because if you stop taking it within the first couple of weeks or couple of months, you will come back with another stroke, and it might be a major one then compared to the first one that you've had.
So apart from the brain, when someone, like, let's say, has stroke the first time, the second time, does it affect any of the other organs in the body? Or can it have a ripple effect to any other organs in the body?
So it's just the brain, but like you have the left side of the brain, and then you have the right side of the brain. So the left side of the brain controls the right side of the body.
Okay.
And the right side of the brain controls the left side of your body. So these two sections of the brain, they control different sections of, like your walking, your talking, your emotional balance, all those things. So it won't affect your organ. The only organ it affects is your brain, but it will affect your functions.
Okay.
So like your speech,
mobility.
your mobility, the way you talk, so your speech could be anything, like the way you talk, the way you think, you can be more emotional, all those things.
Well, I want to thank you both for coming in and giving me an in-depth knowledge on stroke and how the services you provide at CWM. I commend you both. After the break, we will find out more from an NGO called Counterstroke, also speak to a survivor and a physiotherapist at the CWM hospital. Welcome back. You're watching Speak Your Mind, and with me in studio I have the stroke physiotherapist at the CWM, Rehapi Getengetilebu, and also the vice president of Counterstroke Fiji, Luciana Adha. Welcome, and thank you for thank you for coming on the show today. Now, we spoke a lot about stroke and what someone goes through. Recovery process, what's that like?
Okay, for us, our role as a physiotherapist into stroke rehabilitation, we help to optimize the function of the stroke survivors. So we help them to build up their confidence level, and also to help them with their mobility with their movement. So we start from when they come into the hospital, starting their work from bed and out of bed, and with their activities of daily living.
What some of the difficulties you face as a physiotherapy when trying to rehabilitate some of your clients or patients?
Matthew, different patients, they present with different abilities, level of abilities. So we start with category 1 to category 4. So category 4 patients are like those who are unable to move out of bed by themselves. So we help them to get up out of bed, assist them, and teach them on how they can work on and progress with their movement. So our role, we help them. The most difficult part of rehabilitation is being to help with different size of patients.
So what's the reality like in terms of the time frame when they're able to at least do something like pick up a spoon or take a walk, take a first step one after the other?
Okay, thank you. It's
is it dependent on the patient?
The time frame, it depends on how well they can recover. We don't guarantee how long we can help them to regain their full movement. It depends on their recovery, because different types of stroke present with different disabilities, challenges.
And as a physiotherapist, would you say, are we able to cater for the amount of people that are coming in, and you and your team?
Yes, we do. We have seen a lot of different patients with different severity of strokes, and we help them from hospital to their discharges. We plan on their discharge and whom we refer to. We also follow up at their homes, and also we provide them with walking aids if they need walking aids.
And how does, now this question is for you, Luciana, how does Counterstroke factor into all of this, Counterstroke Fiji?
We are an NGO, a non-governmental organization, and we are working together with the stroke unit at the hospital in receiving the stroke survivors who come to us independently, and we run program to empower them in their journey, and we also help in our main vision and mission is to prevent stroke in Fiji, and also to improve the abilities, or to try and combat the disabilities, to reduce disability from those who suffered from stroke.
Does your team work closely with the CWM in terms of creating awareness in communities?
Yes, right now we are working together in reaching out to the subdivisional health centers. This year we have, though the COVID lockdown came through, but we managed to do 3 or 4 altogether.
Yes, we have managed to carry on with 7 caregiver stroke workshops.
Yeah, so we work together in that project, reaching out to our subdivisional hospitals and targeting the health workers and the caregivers.
And this organization, Counterstroke Fiji, is it also made up of other caregivers who've had family members who had suffered from stroke? Or is it you have just a lot of passionate people who want to help people?
Oh yes, Counterstroke has been here for more than a decade. It's from the history, I believe it started in 1988. This was formed by concerned people, who have suffered stroke, like Captain Brown or Dr. Salato, and they got together to establish the organization. It's actually been there to empower the carers and the survivors in the community.
And do these carers and survivors, do they have do they get together to talk about their experiences, or do they have any kind of platform where they're able to share some of the things that they're able to do, some things that have helped them along their journey?
Yes, of course. previously, before we strengthen our connection with CWM Hospital, we were really doing outreach on our own as an NGO, targeting carers from the north, from the west, and even the central area. But we were going very slow. But we appreciate, the strengthening work that and the build-up network that we are having now. So the restriction is there. But yes, the survivors and the carers have their own. The survivors have their own program. It's an ongoing program. It's more central based in Suva, and they do come. It's called Talk Shop, and they come on a weekly basis to come and share stories, or we have a facilitator that comes with related issues on their health or social or financial needs, and that is done weekly, and that is one of the programs that Counterstroke has.
Who are some of the other
survivors.
stakeholders that Counterstroke Fiji works with, apart from the Ministry of Health, of course?
Oh yes, of course. We have some corporate members,
Yep.
and of course the Ministry of Education, and we have we actually are with under the umbrella of the National Council of People with Disability at 3 Brown Street, and it's really handy for us because our stakeholders are all around us, the disability
Which makes
group.
it easier. All
Yeah.
right. Before we
We
go to
have the spinal unit,
Yeah.
the SI,
Yes.
the Spinal Injury Association, who are agency for our equipments, who provide us with things that we need, like maybe a walking
Wheelchairs.
stick, wheelchairs, or diapers, or things like that. Yeah.
Wonderful.
Uh,
Before we go to break, Riapi, would you like to give probably a word of confidence or a word of hope to anyone who may be going through really tough time now with stroke?
Stroke. Thank you, Matthew. One thing that I've seen is that with time we can actually progress with our ability. It's not that when we have stroke we end there. We can always get help and support from our family members. We work as a team. That's why we come in as a multidisciplinary team to try and create awareness on family members, carers, and the survivors that we are there to help them get through with stroke. So it's not the end of the world. We can always carry on and progress.
Thank you for that, Riapi. After the break, we'll hear from a survivor. You're watching Speak Your Mind. Welcome back. You are watching Speak Your Mind, and with me in studio, I have a survivor with me. Now, his name is Jacobchand. Jacob, welcome to the show. Thank you for coming in. Obviously, firstly, I just want to thank you for having the courage to come on the show and talk about your experience. Could you let us know what it was like for you?
Thank you, man. 10 years. Sorry, 5, 6, 7 years, and now granted Sarah, man. Schooling and training,
Yeah.
and then difficulties, man. Yo.
So, I mean, I know it's quite a difficult subject to talk about and experience, and I'm pretty sure that you and your family have been through a lot. What could you just advise anyone who is listening right now, or probably will be watching this later on tonight? What was your experience like when you first felt the symptoms of the stroke coming on?
Thank you, man.
It's okay. Take your time.
Set, man. Gravity saranga, man. Make a mind, man. I can Thank you saranga man.
You've had a lot of help with Counter Stroke Fiji. I'm pretty sure that you
Yeah.
guys have been working closely with Jacob and his family.
That's right. Jacob is one of our youngest member, and he has come through a long way, even to come to this level. Just speaking amongst the survivors themselves, and I appreciate the boldness that he's able to be here to speak his mind through this program.
Jacob, honestly, you are very brave for coming on the show tonight. I want to thank you for today, especially. What are some of the? I mean, with Jacob's case,
Okay.
how has Counter Stroke Fiji helped him?
So within the talk shop program, it's not only talking.
Yeah.
We also run programs like physical activity or exercise. And I work too as a physiotherapist because I'm a retired physio.
Oh, that's
And
interesting. I didn't know that.
I do personal individual assessment and I enhance program for each individual if they need be. For example, for speech, then I will advise them on vocalization exercises, or if somebody needs a splint or walking aid, then we geared exercise towards improvement on that particular working pattern also. Mm.
With Jacob's particular case, was it a pre-existing condition? Like Dr. Tuima had said, with most young people, they had a pre-existing condition for, or was...
Jacob can answer that himself.
That's right man.
You had a pre-existing condition. Was it to do with your heart or?
Nahat sara.
Yeah. And during your recovery, what's something you want to say to another young person who's watching this? Any words of hope you want to give to them?
Pray hard man.
Very hard.
Yo.
I love that. And
And
do you offer any other types of recovery or rather programs, maybe in the field of art?
for crafts, yes, of course. In the complex, in the disability complex that we are in, there are always programs that enhance extra program like that, or extra curriculum apart from our programs. They have the sheltered program, and they have open doorways to us, and also there are business workshops that has been held for, and some of our, even Jacob attended that. Some of our survivors have attended, and some of them are running businesses right now at their own home.
Oh, that's cool.
And this program is really a good time out, when they come and they share and they joke, and they even know everyone about, each other's family.
You want to share anything about that workshop that you learned? Anything you learned from that particular
About the
workshop, Jacob?
business.
Thursday.
Thursday is a talk shop.
Workshop and
Anything you learned from that day?
definitely man. Yeah.
Next thing we know, you'll be making a lot of money because you'll be starting your own business.
Actually, at this time, Jacob is attending the university. He's doing some studies.
What are you studying, Jacob?
Diploma in IT man.
Nice. That is awesome. And you've always had a passion for computers, laptops, programming.
Yeah.
That's
And
awesome.
he is also joining the sports group, and he's vying for this Olympic, and he's doing some, what is it, shot put or javelin?
Discuss.
Shot put and discus. Whoa. I can barely throw anything that far. It is
Thank you.
amazing. I mean, for one thing, you back at school, you active in sports. For a lot of young people who have experienced stroke and probably listening in right now, just imagine the impact that'll have on that. Like, they know they'll be able to do it too. And apart from you say belief in God is one of the driving factors for you. Has your family been a driving factor for you with the support that you've had from them?
Yeah.
How important is that, Luciana, with family being involved with someone's rehabilitation?
Yes, that is a major role that they play at home, because these people, they come out and they return back home. If without family support, I don't think they will enjoy, the journey as they are. Some of our clients, who, they have been so diligent that they've been with us for more than 10 years. Some have suffered 2 strokes, and they are still coming, and they are still being supported with good family love.
I want to thank you both for coming on the show, and the team from CWM. Thank you so much, Jacob, for having the courage to come on the show today. Thank you, Luciana, and your team, Counterstroke Fiji, for all the amazing work that you do. Unfortunately, this is where our show ends, but if you want to help donate or contribute to Counterstroke Fiji, please visit their Facebook page, and I'm pretty sure you have a website as well.
Yes, that's true.
So, like I said, go to their Facebook page, see how you can get in touch with the team, how you can contribute, how you can help. And remember that on the 29th of this month, October, which is this Thursday, we'll be celebrating World Stroke Day. That's it from us and the team. You're watching Speak Your Mind.